All right. I don't really want to start yet because
Lambeth, Southwark, and oh, Lambeth, Southwark, and Lewisham,
yeah.
I believe. Yeah, and particularly looking at awareness for breast cancer and prostate cancer.
Okay. And
And
we've
so
got
I can talk about the services that GP practices offer for both of those things
yeah.
and what we'd like to improve.
All right. And Jeff, can you tell me more about the collective campaign that is going on? That that that,
Well,
that we're focusing on Vibes FM.
okay. I mean, at the present moment, the main thing that I could really elaborate on is the awareness of prostate cancer within our Black community.
Yeah.
And being a prostate cancer survivor for going now 6 years now, I will basically share my lived experience and also a support group that I've set up for men that has been diagnosed with prostate cancer. I'm offering them, let's just say that extra help, giving them a safe space where they could talk about their issues. It's a non-judgmental space. Once you've been diagnosed, sometimes you get cloudy, don't you? You hear you got cancer, then all of a sudden just white noise. You don't know, you're not hearing anything that the doctors are saying. And all the information they're giving you, just doesn't matter. The fact is, wow, I've been diagnosed with cancer. So we always seem to associate cancer as a death sentence, especially prostate cancer. Men think is a death sentence, but as the doctor, I'm sure, will clarify, it's not. It's not a death sentence, and it's one of the most commonest cancer in men, and common, and yet one of the most curable cancer if caught early.
So that's the key, is catching it early. Early
Absolutely.
Yeah.
Yeah.
All right. So
Because if you catch it early, you're likely to die of something else other than the cancer.
yeah.
Yeah.
Okay. So I'm gonna stick with the prostate side of things at the moment. And yeah. So if you could just let us know where the safe space is, Jeff.
The safe space. When we talk about safe space, being specific. I'm talking about a safe space where men could come and talk. Yeah, they could elaborate. We have safe spaces in Brixton, Croydon, Peckham, Lewisham, Bermondsey, etc., etc. Right. But the main thing that I would really want to encourage is for men to go and get themselves tested, get a PSA blood test, prostate-specific antigen blood test. Okay, this blood test will give an indication, okay, of how, let's say, healthy your prostate is. If so it's not a scary, situation to go through. As we've often hear people say, wow, you go for a blood test, it's a DRE, yeah, all these myths, but it's a simple blood test. It's just like going to give blood, and it takes less than 5 minutes, and it's over, right?
And then you wait for
Once that,
results.
yeah, the results will come back to you. Some places take about a week, some 2 weeks. It all depends. If not, you could always ring your
Usually less
doctor.
than a week.
Yeah, ring your doctor and find out, what's my result. They will give you. They sometimes tell me if I'm wrong, doctor. They say, oh, okay, it's nothing to worry about. But I always say, even though you hear it's nothing to worry about, ask what is your PSA reading.
Thank you.
That's
Yes.
very important. Yeah.
That's
So
my main message too.
Always ask what is the PSA reading, even though
that's right.
they
You
might
need
say,
to know
"Oh,
your number.
you're safe, you're safe, you got nothing to worry about." But ask that number and find out. And why would you both? You're both agreeing about asking the PSA number. What's specific about that, or why do you both say that?
Because it's a number that is going to change over time. So you want to know whether your PSA is staying stable, or if you've developed an early form of prostate cancer, whether your number is going up. And so that's why you need to know what your own numbers are. You can't rely on someone just telling you, oh, it looks all right to me.
Yeah, you're in the safe
You need to
zone.
see
Don't
it.
worry.
Yeah, and which is why as GPs, we're making the medical records accessible and available so that you can view your own medical records online. We encourage everyone to sign up to the NHS app so that if you're having regular blood tests, like a PSA blood test, you can just click on and see your result for yourself. And you can look back at your previous results and get an indication.
Difference. How often do you recommend someone getting checked? Once a year or something? The PSA
Once a year,
test?
yeah. And also, if it's Black men over the age of 45 should have a PSA blood test once a year.
Yeah.
Men in that age group should also get their cholesterol checked and their blood pressure checked.
Yeah.
And their blood glucose checked. So that could all be part of the test. Yeah.
Can I just also add to the age of getting tested? If, for instance, you have a family history of prostate cancer, okay, you can go and get tested a little earlier than 45 if you have a family history, okay? There's also a history where your mom may have breast cancer or ovarian cancer. It develops what they call a BRCA genes, which runs down the bloodline. So there are times where the male in that family who follows that bloodline could be at risk of prostate cancer. So that's why it's important for them to go and get themselves tested. Well, at least speak to a doctor if they've got any, worries whatsoever. And again, just elaborating because we're talking about prostate cancer, it's not something that we should fear. Yeah. And having prostate cancer, it's not a disease you catch because you've done something wrong. You don't need to qualify, for that.
So
okay,
bad diet and stuff like that doesn't come into play.
No.
Nothing like that. It's just
not necessarily. Talk about diet. I had a fantastic diet. I suppose we all hear about the alkaline diet, right? Where I thought my body was alkaline. Oh, I'll never get any cancers whatsoever.
Cancer can't live in an alkaline body and all that sort of stuff.
Exactly. But I end up with prostate cancer. Yeah, I was surprised. But then when I checked my family history, there's a bloodline, and it was inevitable that I will get prostate cancer at some point. My eldest brother right now has just been diagnosed with prostate cancer.
Oh my goodness.
So, yeah, but at the same time, it's important for someone like me with lived experience that's able to be there to guide him along. Because if it hadn't been for me and the experience that I've had, he told me he would have gone crazy. Because as men, you know what happens? Prostate cancer, oh my God, erectile dysfunction. Yeah, that's the main issue. I'm not going to go and get tested because I don't want my manhood being tampered with. But you got to put health over pleasure. Yeah. It's 5 years on, going on 6 years now. And at times I look at myself and how I feel. Did I really have prostate cancer? Yeah.
Because you feel good.
Exactly. And it's caused me to look at life so differently. And things I normally would take for granted, I no longer take it for granted. Every day when I wake up, I give thanks. Every day I give thanks. And every day I meet someone, I always say to them, make today one of your best days. Because come what may, don't let nothing take this day away from you. Make it one of your best days. No matter how you're feeling, you can grab something positive from that. So all I'm trying to say is that prostate cancer itself is just a warning. Yeah. If you're diagnosed with prostate cancer, it's a warning. It's time for you to readjust your life, readjust your lifestyle. Yeah.
Can I bring you back a little?
Sure.
To the sexual part of it and your functioning as a man.
Mm-hmm.
Does it affect
it's important
it? And
talk about it.
part one, does it affect it? And part two, it is fixable once you've sorted out the issue, which is the prostate. Once that's sorted, if there is some dysfunction in that area, it's repairable, right?
Right. Can I just say one thing, first and foremost? Every man's experience is different. Yeah?
Yeah.
Every man. Now, it took me a long journey. It took me 2 years before I left from 6:30 back to 6 o'clock, if you understand the phrase.
Mm-hmm.
Yeah? 2 years. There are some men that it takes them 6 months. Some men it takes them a year. It all depends on the individual. And yes, having prostate cancer does affect your manhood, as one would say.
Yeah.
And in certain cases, it's fixable. Yeah, there are certain methods out there that can help you get back into the bedroom.
Yeah.
But one of the main things which I found is the mindset. The mindset plays such an important role. Yeah. I had my prostate removed. Okay. So before I had it removed, I spoke to my doctor and I said, listen, I would like to have a nerve sparing operation, meaning that they will spare as much as nerves as possible that helps to give that man an erection. I had that nerve sparing operation, and thank God it took a while, but it worked. Yeah.
Mm-hmm.
And all I could say, Lazarus has risen. Yeah.
Amen.
So yeah, he's come forth. And that to me is important. But it also showed me that sex was not as important as my life.
Mm-hmm.
My life plays much more greater role than the pleasures of life itself.
Yeah.
Yeah. So as I say, we live to tell the tale.
You wanted to
I
ask
think
something?
that's a really powerful message.
You wanted to say something, Doctor? Go ahead.
I was saying that's a really powerful message, particularly around the mindset. For whatever cancer you might have been diagnosed with, it's all about helping people with their mindset and the support, because cancer's much more prevalent nowadays. We have brilliant services in London, and we're both talking from Southeast London point of view, where the services are excellent, internationally renowned. So people should have their cancer diagnosed early, have their treatment, and then go on to enjoy life with a much greater enthusiasm and health. So yeah, but we're talking about prostate cancer right now. And again, it's important to have it diagnosed early, because then the surgery you need will not be as extensive and you can have that nerve sparing surgery.
Yeah. And I want to move into talking about the breast cancer side of things now. And, you know, what preventive measures or at least early diagnosis measures can people do for themselves? Obviously, testing, just like we said with the prostate cancer, testing, but is like self-checking and stuff like that important?
So yeah, you're right. There is self-checking and self-examination.
Self-examination.
And so there are a number of different websites that can help people with that. The one that I like to recommend people to go to, it's called copperfeel.org. COPPA feel FEEL.org. And you can register, and they send you a text message every month to remind you to check your breasts for any lumps. And they've got good videos that show you how to do it. The thing about breast cancer, though, the classic thing is finding a lump. In some women, even the tiniest changes can be cancerous, and they don't even form a lump until later. So that's why from the age of 50, women are invited to go and get a breast screening mammogram every 3 years. So it's not quite as simple as just going to get a blood test. It's about a 20, 30-minute appointment where your breasts are x-rayed.
Okay. All right.
So what we need to do in South London is get more people going for that test, because
A lot of people,
the
a lot of
early
women,
diagnosis rate is low, and really we should be diagnosing breast cancer stage 1 or stage 2, not when
so
it's stage 3 or 4 and it's spread to other parts of the body.
it definitely, doctor. Does From what I'm hearing, does that mean a lot of women are ignoring letters that come to them? Because are letters sent out once you reach that age?
Letters are sent out, yeah.
I remember getting a notification from my doctors when I turned 40 for a well man test, just to go and get a
That's
well
it.
man's test. So letters like that are sent to individuals and they ignored it. They ignored it.
And people ignore it.
Women
So
are
what
ignoring.
I've discovered now is that they triple book all the appointments so that they still have people to see, because so many people are not coming to the appointment. But that translates into people then not finding their breast cancer early.
Of course it would. Yeah,
Mm,
because
mm.
testing
And
and that's how you're gonna find it, isn't it?
that's it. You'll only find it when it's grown into a significant size lump. Whereas the whole point of doing the X-ray, the mammogram, it shows tiny little changes early on.
Yeah, so that's going to make the difference. That's definitely going to make the difference. In and around Lambeth, are there a load of centers where people can go to?
So there's a breast screening website that covers the whole of London now, the London Breast Screening Hub. So you can Google London Breast Screening Hub, or you can go to a phone number, which is 0203 758 2024. And you can book yourself an appointment. If you know you've missed that appointment and you had a letter last year, you can go online or phone them and rebook your breast screening appointment. The actual screening and the x-rays themselves takes about 3 or 4 minutes. That's all. That's all. People
But,
say, oh, I don't want to go, it's going to be uncomfortable. Yeah, it's a bit uncomfortable.
but
You
it's not
know,
as
I've had it
uncomfortable
myself.
as
But
having to live with cancer and then deal with
exactly.
maybe chemotherapy and all of the rest of it that comes with it.
Yeah,
Or
because
having,
there is something about how breast cancer affects Black women, in that the cancer doctors think that the breast cancers that affect Black women they grow faster and are more invasive. So as Black women, it's particularly important that we go for the early cancer screening x-rays, the mammograms, because if you catch it early, it can be completely removed, because
and
it's not gone into your lymph nodes or into your bloodstream or into your bones.
you mentioned from the age of 50 um,
Mhm.
upwards, but what if there's history of it in the family? Is it recommended earlier for?
So if you have a family history of breast cancer or ovarian cancer, then yes, you can ask your GP to refer you to a breast cancer family history clinic. And that's where they look at your family tree, um, and offer you more frequent interventions. So some people, it depends on what the family history is. So some people have the BRCA gene that Jeff was talking about beforehand, and those families are offered some of the most radical interventions, like double mastectomy or have your ovaries removed as a preventative. If that family has been shown to, if everyone's a gene carrier, they're most, very, very likely to get breast cancer. That's not as common. That's really not as common to be a family carrier.
Yeah.
But
Okay.
there are family clinics, family breast cancer clinics that you can be referred to for
Okay.
the younger people in the younger generation. So
Okay.
the x-rays aren't as good as picking up the cancer below the age of 50. They can do it, but it's not as easy, because women are more likely to have gone through the menopause after age 50. And the hormones make the breasts very dense on an x-ray picture, which is why you need to self-examine and feel. So you register for the monthly text message, and that reminds you to check your breasts.
Yeah, and if they're not sure, they can get advice on how to and what.
Exactly.
Yeah.
Yeah. And as GPs, that is the key thing. if you're trying to get an appointment at the GP practice, you know, it's important. I've got some changes. I'm worried about cancer. And the receptionist will fast track you into an appointment within a couple of days, rather than telling you you have to wait 3 or 4 weeks. We know that access is difficult for GP practices.
Mm-hmm.
The other way of getting through, if you have online access, you can book appointments online. Every single practice also has a website that has a contact us function, and you can send your queries through the practice website. Yeah.
One thing from my own experience on the prostate side of things is I went to my GP and I had that more invasive test. And I said I wanted the blood test as well, and they didn't actually give me a piece of paper there and then. I had to leave and then go back to collect a paper that I can bring to the hospital to get the blood test, but they
For the
didn't
blood
do
test.
at my GP. I was like,
So
why are they
my
not
other main job,
GP?
my other main job is educating my GP colleagues that things have changed in the management, the assessment and management of prostate cancer, and that literally feeling the prostate by doing a rectal examination isn't the most essential thing. The PSA blood test is the first test, and if it's raised and it's raised on a second level, then we refer people to the hospital, where they now have an MRI scan of your prostate to see if there's a cancer there.
But my GP is sending me to the hospital for the blood test, for the PSI blood test. They didn't even do.
Yeah, most GP practices haven't got staff to take the blood tests.
Oh, okay.
So the blood test places are kind of dotted around each borough. It's usually in a health centre or at the hospital.
Okay.
Some practices will offer it, and they'll offer it for neighbouring practices. But yeah, that's an NHS cuts thing.
Yeah, that is a common occurrence, unfortunately. And that, you know, if I could just inject as well quickly, we're talking about breast screening. Yeah, we also got to remember at the moment there is no screening for men with prostate cancer. Okay, so it's always just important for us as men to just go and get ourselves that regular yearly check. Yeah. As you know, doctors rightfully said it in a nice way. The DRE is no longer something that, you know, it has to be a must. Yeah. You know, most men fear that, so they don't go to get tested. They think, oh, I'm not going to get nobody doing this, and you know, but that's no longer the case. Yeah. Another thing I just wanted to also say as well. When we hear many times, you know, the PSA blood test is, you know, false positive, yeah, which, you know, is fine, okay. But one of the main things I want to say is that as a man, when you're going to get a PSA blood test, okay, be sure not to engage in any sexual activity the night before. And then you say, oh, in the morning, I'm going to get my blood test. You're going to get a raised reading. So it's always advised at least to go 48 hours or 72 hours after anything like that, strenuous, even riding a bicycle. Okay, anything too strenuous, you know, don't go for a blood test the next day, a PSA blood test. Go ahead.
And let me explain why that is. It's because the prostate gland, it's about the size of a walnut, and it wraps around the tube that takes the urine out of the bladder. And the prostate gland actually makes sperm and semen. And so if you ejaculate, that causes a minor rise in the prostate, which then the PSA, which then goes down again. So you don't want to have that test and catch a rise that you think, oh my gosh, is it cancer? No, it's just a natural rise after ejaculation. Similarly, if men have a urine infection, that can make the PSA go high. So that's why if you have a test that's slightly high, you would always check it, repeat it, check for a urine infection, and then get an assessment of the prostate gland through an MRI scan. So that's why, yeah.
We haven't got long left on the platform. So if there's anything either of you just want to get out there to the public, for the public to know, I would say now's the time. Go ahead, Jeff.
Yeah, I just want to say quickly that sometimes when you get a high read in your prostate, okay, it may be a case of you having a large prostate, an enlarged prostate, not necessarily meaning you've got prostate cancer. As we've rightfully just heard, the king, you know, who's now come out publicly and said that he had to go to the hospital because he had a large prostate. It's not cancerous. It don't necessarily mean it's cancerous. And it doesn't mean your large prostate is going to lead into prostate cancer. Yeah. And get support. It's always important. Get support on the straight of the minute you've been diagnosed with prostate cancer, get support. My support team is there. Cancer Don't Let It Win. We're available on the internet.
Again, also, a bit slower. That's
Cancer.
CDLIW.
Yeah, that stands for Cancer Don't Let It Win. Okay, you could always check us out on the web, and not forgetting my friend Errol McKellar, who's been doing this campaign for a while. You know, me and Errol rub shoulders together, and we're pushing ahead. Okay, brilliant. So there are groups out there that are doing something for our community.
All right, and Dr. Diane Aiken, that right pronunciation?
Yep,
Aiken.
Yeah. So my message for the prostate again is that if you've heard about the PSA blood test and you fall into the category where you should have it, then please approach your practice to ask for the blood test. Don't take no for an answer. Ask for your PSA blood test. You don't have to get a consultation or an appointment with a GP, because now we do a lot of our admin separate to the consultation. So you could send a request through the website, for example. Some practices are actually sending out text messages to men over age 45 who we think should have a PSA blood test. So if you get one of those text messages, please respond and ask them for the form, and you can go and pick it up and get your blood test done. We've sent out 28,000 text messages in Southeast London. And as a result, we found 35 people who wouldn't have had their prostate cancer diagnosed otherwise.
Sounds, I mean, how many people came forward out of all the texts though? Because that was a lot sent out.
A lot more. It was several hundred people came forward.
Good response.
And then out of them, 35 people had cancer.
Oh, okay. And was that?
I'm sure lots of people didn't come forward who have got cancer and have still yet to be detected.
So the message really is, you know, fight the fear and get tested.
Yeah. And it's the same for breast cancer too.
Yeah.
You know, it's inconvenient. You might have to take some time off work to get there, to get the appointment done, but it's well worth it.
It might prove to be less time off work getting the test done than having treatment for cancer at a later stage.
Having cancer costs a lot of money. Having to attend treatment, you know, backwards and forwards, time off work. It's worth going to get the screening test. Yeah.
Early diagnosis is important.
Absolutely.
All right. Anything else you want to add, Jeff? Mr. Jeff Thompson?
You just said it. Early diagnosis. It's the best way to go. And, you know, cancer, don't let it win.
Don't let it win. Don't let it win. So that's a group. Watch out for that group. You can find you on social media. CDLIW.
No, on social media it will be Cancer Don't Let It Win.
Okay.
On Instagram. Cancer Don't Let It Win on Twitter and TikTok, as they call it. I'm getting familiar with all of these things. All right, same thing. Cancer Don't Let It Win.
All right.
And the website is www.cancerdon'tletitwin.com.
All right, so you're gonna be live on Vibes FM this week, Friday morning.
Ooh, Friday morning. Oh,
we'll replay this conversation for all to hear. Yeah. And I'm gonna share it on my social media platforms as well, YouTube and such. So yeah.
Thank you very much, Mr. Mighty.
You're welcome.
So
Is there
excited.
anything in particular taking place? Is there? I think last week they had something in Morley's in Brixton. I don't know if you knew about that.
Jeff and I were both there,
Okay.
and we had a panel discussion, similar questions to what you've asked us today about breast cancer and prostate cancer. And it was really good of Morley's department store to give up retail space on a Saturday afternoon
Yeah.
for a health promotion event.
And
We
Alison
really
was
appreciated
on
them.
the panel. Alison Mason was on the panel with you guys.
Alison was our MC, yeah.
So she let us know, and we mentioned it over the radio as well at Vibes FM. So yeah,
Okay.
we're working with you. We've got to work with the community. We are like London's leading community radio station. So
Oh yes, Vibes plays in my car. Yeah.
all right. Thank you both for taking time out and sharing the information with us. And you know, anytime you're ready, just reach out to us. We're always here, you know, to get things out.
Thank you. Thank you very much.
Thank you very much.
All right then.
Take care.
Thank you very much.
Bye.
Bye-bye.
Yes. Bye bye.